Сайн байцгаана уу хүн төлөөлөгчтэй. Өнөөдөр манай de facto нэвтрүүлгийн зочноор Нэгдсэн үндэсний байгууллагын Хүүхдийн Сангийн Монголд суугаа Суурин төлөөлөгч ноён Алекс Хaйкенс гэж хүн оролцож байна.
Монгол дахь Нэгдсэн үндэсний байгууллагын Хүүхдийн Сангийн суурин төлөөлөгч Алекс Хaйкенс. Алекс Хaйкенс Индонез улсад бохирдсон унтны усны их усүрээс хүн амын эрүүл мэнд, хөдөө аж ахуйн үйлдвэрлэлд үзүүлэх нөлөөний талаар судалгаа хийж, байгалийн шинжлэх ухааны докторийн зэрэг хамгаалсан. Голландын Утрехтийн их сургуулийн биологийн ухааны магистр цалт тэрээр Голланд улсын иргэн. 2003-аас 2013 онд Нэгдсэн үндэсний байгууллагын хөгжлийн хөтөлбөрийн Аз номхон далайн бүсийн оффист бодлогын зөвлөхөөр ажиллаж тус бүс нутаг дахь Нэгдсэн үндэсний байгууллагын хөгжлийн хөтөлбөрийг хэрэгжүүлэгч улс орон тэдгээрийн засгийн газарт уур амьсгалын өөрчлөлтийг даван туулах асуудлаар бодлогын дэмжлэг үзүүлж байсан. 2013 оноос Нэгдсэн үндэсний байгууллагын Хүүхдийн санд ажиллаж эхэлсэн бөгөөд Нью-Йорк дахь төв оффист уур амьсгалын өөрчлөлт, эрчим хүч болон байгаль орчны доктортой байдал хариуцсан ахлах зөвлөхөөр ажиллаж, энэ асуудлаарх байгууллагын бодлогыг тодорхойлон хэрэгжилтийг удирдах байсан. Нэгдсэн үндэсний байгууллагын Хүүхдийн Сангийн Монгол дахь суурин төлөөлөгчөөр 2017 оны 7 дугаар сард томилогдсон.
Good afternoon.
It's good to be back. Good to see you.
Very nice to meet you again on this show, after 3.5 years. So I understand it's a time for you to move to your next work, which is Azerbaijan, I understand. And I'm happy to have this opportunity to discuss issues related to children of Mongolia, challenges we face, and certain jobs, projects you have been already successfully implemented. So that's why let's go one by one. And first of all, we cannot not start with the situation created by COVID-19, not only around the world, but in particular in Mongolia. Since many people, children have really affected almost more affected than anybody else as a part of population. So how do you find that impact on children and how this government is tackling from your point of view?
Yeah. It's been an extremely challenging 1.5 years. I remember well that I was visiting one of the Sungs in Bayangkongor in January 2020 when we heard the news, and my team and I, we immediately realized that this would have massive consequences for the world and for the country. We also quickly realized that closing the schools and the kindergartens would have profound consequences for the children. Of course, in terms of learning, and I'm sure we'll talk about that later, but also in terms of protection, in terms of nutrition. Because suddenly you have all these kids, staying at home. Well, who is looking after them? Many kids are relying on the lunch provided by kindergarten and by school. Who is feeding them? And then, of course, we saw it indeed happening that more and more child protection issues came up, more violence at home as well. And in a way, what happened? There was more and more stress in society, people losing their jobs, more tension in the family, nobody can go outside during the lockdown periods. And then if there is already a history of violence in the family, of course, under stressful circumstances, you see those things escalating. We also saw a number of very sad cases whereby children were left home alone, locked up. And then there were horrible incidents whereby a number of children have died because of that. So from a child protection perspective, it's been very tough. From an education perspective, it has been very tough. But in terms of action, what do you do about it? One thing was what we did, within the 2 weeks, we had a clear action plan in place. We received initial funding from our regional office so that we could kickstart the work, get the data and the evidence on the table, what is the situation, and then move into action in terms of, for example, providing practical hands-on support to social workers in terms of looking at those cases better, provide more support to the child helpline to make sure that they can better receive, distress calls from children, deal with it, support the multidisciplinary teams to look better after all those cases that were emerging. So a lot was done there. Then in terms of education, many big issues had to be addressed. The TV learning was a good start. And at the same time, we also realized that much more had to be done. Because later, when we looked back, we realized that about 30% of the children basically did not do anything in terms of education for the last year or something.
We go all these issues probably a bit more in details. Before that, in general now, almost 4 years, you have been in charge of that important UN organizations, which has is being played from the beginning very important role in providing vaccines to Mongolia. There is a special even law which speculates in particular provision that Unicef bought vaccines. The World WHO approved ones, etc. So in that sense, you have spent 4 years in Mongolia. What is the highest point you would like, particular highlight of the work during these 4 years?
Talking about vaccines and not talking about COVID for a while, I think one of the highlights that probably went under the radar is that I think it was 2019, in January 2019, we got clear red flags about a possible outbreak of measles in Mongolia. This was already happening in a number of other countries in the region and across the world. And that's the last thing that you want to happen here in Mongolia. So very rapidly, we moved into action with the Ministry of Health, with WHO. We quickly mobilized the funding, more than $500,000 through our headquarters. We then also quickly managed to procure the necessary vaccines, bring them to Mongolia, and then with the support from WHO, those were then distributed and given to children across Mongolia within very, very short time.
All children?
All children that needed a booster, they got that booster. And as a result, there was no measles outbreak. Nothing happened.
When the outbreak, first cases, how many cases there were?
I think there were only 1 or 2 in Mongolia itself, and that was the red flag. Because
which part of the country?
I believe it was in Umnugovi, there was one case.
Yeah, Measles.
Yeah.
Which we regard as we have completed a long time ago.
Yes, but there were weaknesses at that time in terms of
not only
vaccines.
Mongolia, several other developing countries have discovered this kind of, it's also epidemic things, pandemic. Okay, interesting. And the vaccines now, the program now we are implementing in Mongolia in terms of vaccines. How do you see from a side in general?
Yeah, I think if you look at Mongolia's immunization program and the quality of it, and you compare it to many countries in the region, it is actually a very solid program. So this is, a big compliment to the Ministry of Health and the health workers that overall the vaccination program, covering all these different vaccines is very solid.
By now we have almost 90% of adult populations is covered with, I think, even second doses. But now still people keep getting infections, and they say 95% of those infected are people who have not yet got, in particular children, younger people. Would you agree? And what is the reason that now we have now increasing amount of infections daily?
Yeah, well, I mean, on COVID, I hope that we have reached the peak, and that we now, the coming weeks, will start to see a decline. Fingers crossed. Obviously.
In particular with the children's vaccination.
Yeah. So now I think that, there was of course quite a lot of activity, before the elections. People traveling, people mingling, and that has likely resulted in increased numbers of infections. And people were to some extent surprised, like, I'm fully vaccinated. How is it possible that I still get infected? Well, because that's how the vaccine is. The vaccine does not give you 100% protection against infection. What it does, it gives you solid, protection against severe effects and fatalities. But you can still get infected and you can still get mild disease, but not severe. No need for hospitalization in most cases. And the chances of dying after you have been vaccinated are very, very small. So it gives you a level of protection, but not 100%. And that's why it's so important we continue good practices like social distancing, hand washing, and so on.
Yeah, that looks like in that way everything goes, and hopefully it came to the peak. Hopefully from now it will go down, and with the more children vaccinated, with the program that the government now is planning to do. Alex, let's look at a bit bigger picture of two things in Mongolia. First of all, I remember when you came here, you are yourself as a ecology professional, in particular air pollution professional, and that time it was quite dark days in winter in the town in particular. Then a year after, or from a year after, I think the colors changed. People not that dark, and things seemingly became better. But however, still there are problems because the content of that pollution is different, poisoning is different. So in general, you came here to help to save children from air pollutions. How do you see the results of that program?
Yeah, it's kind of a glass half full and half empty in many different ways. The first reason I say it is because I was hoping we could really work hard on it for the full 4 years. But like many other initiatives by many partners, COVID did make it more difficult and did kind of reduce the amount of work that we could do on tackling air pollution.
Yes.
So that's kind of where I wish we could have done more.
Yes.
But on the bright side, if I look at what we were able to achieve, there is a lot that we can be happy with. Maybe just a few examples of that. First of all, people now really understand it is a maternal and child health issue. Damage to the lungs, damage to the brain, damage to the unborn child. This is not about the environment. This is about your own children, about their brains and their overall health. So that's clear. We also did a good job with our government counterparts to start training health workers to really understand air pollution in the context of health and how they can advise, for example, pregnant women during the wintertime about what to do and what not to do. Then in terms of indoor air quality is another issue that we really put on the agenda. We made it clear that indoor air quality, where children are spending hours in the kindergarten, in the schools, it needs to be taken seriously. And the same with indoor air quality in the hospitals. So recently the government has approved new decrees, new guidelines, new standards with regard to indoor air quality, starting with the hospitals. And now also we are making a final push, and also a number of parliamentarians are supporting it, to get the indoor air quality standards also approved for kindergartens and schools. And that means that there is a standard to follow, and that the building codes for kindergartens and schools also will be adjusted so that the new schools and kindergartens to be built will come with proper mechanical ventilation.
These standards are as a law or requirements or regulations? What is the status?
I think it's regulation level, yeah.
Yeah, I wish this, like it will, they are not disappearing as many other regulations not implemented. One thing is to understand the cause of problems, then you create or set the standards. The other thing is enforcement, and hopefully Mongolian government will do, which is quite task. It's a matter of changing completely the windows, buildings, put the air, probably air conditioning, purifiers. It's a lot of jobs. So hopefully, still there is at least the standards we also civic society to follow, right? Another issue about tough, bigger picture issue is children's right. And not to protect children's rights, there should be, again, legal environment for that, and you should enforce it. From that perspective, how you see the situation of protection of children's rights in Mongolia?
Yeah. There is progress, and there is indeed still a lot of work to do. I mean, for example, the amendments to the family law still haven't been approved by Parliament, and I do hope that will happen very soon. Also recently, we did an extensive evaluation of the law on child protection, and they're very clear there are significant weaknesses that need to be addressed moving forward. So the framework is there, and it is definitely moving in the right direction, but there is fine-tuning, important fine-tuning that needs to be done in terms of the laws themselves. And then, as you pointed out, also like with many other laws, the implementation and the capacity to implement in terms of human resources and in terms of financial resources.
Just the case of, let's say, this family law, what are particular provisions are added or amended in terms of better protecting the children's rights?
Well, the issue that we have at this point is that there is a lack of some of the important details. For example, child at risk is not clearly defined. And we believe it's very important to articulate what do you mean with child at risk? Who are we talking about? And that is a long list of children at risk. I won't list all of them. I don't want to miss out any of them. But whether you talk about, for example, children with disabilities, children from ethnic minorities, children victims of violence, especially sexual violence, nomadic children. There's a long list of children at risk.
So what you're saying
to
is
be in the law.
So what you're saying is, in spite of this long list having being embedded in the law, the draft law, which is the law is not approved yet. What you're saying is it is still to be extended.
It's not yet in the law. In the law at the moment, it only says children at risk without.
Oh, I see. Just one word.
Exactly. Without. So it's a matter of deeper definition of some of these issues. So there is also another issue with alternative care, which is mentioned in the law, but it's not specifically spelled out. What do we mean with alternative care?
What is that?
It's, for example, you can place a child, in a worst case scenario, in a residential care facility. But you can also look at, are there other family members that could look after the child? Yes. Or is there a family friend that can be trusted that can look after the child? So, it's all about details, especially when you talk about the law.
They have not specified
Be specific. And that's some of those details. And we've been sharing, very specific recommendations, literally word by word, on what we believe should go into those laws.
Which agency who drafted this law, final version, that I can talk to?
I think it's, we work mostly with the Ministry of Labour and Social Welfare. So that is an important, very important actor, of course, in this context. But then there are, of course, also other stakeholders. And also we have parliamentarians who are very keen, especially the Women's Caucus, for example. They are very keen to move this law forward. I recently spoke with the Speaker and with Member of Parliament, Ms. Bulkantuya, about it as well. So there is work to do with different stakeholders to push on those details in these laws so that we get it right now.
Okay, so I would be happy to follow up.
Thank you.
Because without these details, it's very hard to enforce because they don't know what is that particular the risk is about. We talk about.
Yeah.
Okay. Another issue I would like to touch upon it was I have seen first a very interesting document that you have as UNICEF Mongolia prepared for 3 candidates to the president election. And these 5 contents you have put kind of opening very seriously some issues we are not talking inside of the society. I'm glad that you address, and I understood all three can principally agree with your, which is quite achievement. So let's talk it one by one. Okay. All right. The first one you talked about was digital divide in education. All this appeal is to do with, you asked them to address 5 key challenges that children face today in Mongolia. First one was about digital divide, and you have brought statistics that some 170,000 children have not access to TV or internet at this time when the schools are closed. So you specified as a challenge. So how to address this challenge?
Yeah. Well, first of all, we need to be very clear, where are those children?
Okay.
If we talk about access to the digital world, which is now more and more critical than ever before in terms of learning, in terms of development opportunities, you need to know, where do we have those weaknesses in terms of access to TV and internet, and then indeed come up with strategies to reach out to those children. You need to work not only within the government, but it's also very important to work with the private sector. With the telecommunications sector, to figure out how can we address that. And part of those problems, of course, really relates to the remote communities, which is difficult. Also from a financial perspective, how do you make it attractive for a private telecommunications company to provide services to these very remote areas? So there are. The technology, that's not the problem. It's all there. It's a matter, I think, of talking through with government and the private sector in terms of public-private partnerships on strengthening that outreach to the remote communities.
Indeed, not only it's a housing issue, but also before making housing in this remote area, the operator companies can address these issues, having in mind specifically the situation due to COVID-19 in Mongolia. Very interesting point. The second, you have raised an issue of mental health of children. I myself was a bit shocked, because it says the suicide among children aged 10 to 14 was 3.3 in 2003, and it became 3 times more 2019. And also, it also says that 30% of children have behavioral, emotional, and behavioral problems. 30%. 9% has emotional and behavioral disorders. How you make the statistics, and how you suggest we address it?
Yeah, so the numbers, of course, come from extensive research and analysis that have been done over the years to collect that information, and there is still a need for deeper understanding of these numbers. What is really behind it? Because indeed,
I found out Unicef professionals Mongolians are only professionals who are doing this kind of very thorough research and analysis, which come up with this kind of statistics. We don't like it, but it's true. So how
exactly you have to, issues, even if you don't like them, you have to put it on the table, because it's not going away. And there is a big stigma on it, because I remember 2 years ago I spoke about it. In I won't say where, I spoke about it, and there were a few people in the room who basically stood up and left, because they say, no, we don't have suicide among teenagers. I don't believe you. And they walked away. Now that's very problematic, because how are you going to help teenagers?
If you avoid it.
If you avoid it. So you have to talk about it. And also, the pandemic made it even more clear than ever before. We did additional analysis over the duration of the pandemic among school children. And we saw the levels of stress and anxiety among school children, really going up. More than half of them were really completely stressed about the situation.
At the time when the children are supposed to have more shaping up of their education and the bringing up in the schools. They are sitting at home, as you said, in the bad conditions in some of them.
Yeah.
So it's the very fact that we start to talk about is already a good challenge.
Yes, you don't want to talk about it, but for the sake of these children, we have a responsibility to talk about it and then work with them to find solutions. Because talking is one thing, but finding solutions is the other thing.
Well, at least they need to start
Yes.
to talk about it.
Yeah.
This is the problem, which is proved by the researchers, and it's on the table. Please solve it, right?
Yeah.
That I think the very putting the questions in that way is, I think, strong.
And what is important, we do not take a medical approach. This is not about diseases. This is about mental health, well-being. So this is about, for example, healthy relations between parents and children, healthy relations between siblings, not being bullied at school, not being harassed on the internet. So there is no medicine for that, there is no vaccine for that.
Less and less people talk about for example, bullying or harassment.
Yeah.
And still we need to address that issue, which is becoming ever stronger, sharper during the pandemic.
Yeah, absolutely.
The third issue you have as a challenge raised was online child protection, in which there is another very much warning kind of statistics where 85% of children stated as having one or more social media, 60 and 70% of sexual image or content transmissions goes unreported. And according to the US, there is National Center for Missing and Exploited Children. There is a data for 2019 which says 4,300 child sexually abuse and exploitation in Mongolia. 43,000. It goes kind of unnoticed or untalked. What a terrible picture.
It is, and it's this dilemma that we have. In the first challenge, we asked the president, get children better connected to the internet, because that's where you can learn and where you can engage. And then you see the dark side of the internet, and that is the risk of a child being online in terms of abuse, exploitation, and exposure to inappropriate contents. So it's this mixed feelings that we have in society about the internet. We want the kids to be online because then they can learn. We don't want them to be exposed to inappropriate contents. So that's the fine line.
Best practices of addressing these issues in the world?
Yeah, well, you say the world, and that is where you should start indeed. You cannot confine it to your borders. So the first very important thing, and that is already happening, is close collaboration with other countries, because the internet does not care about your boundaries. It will go across. So you need to work very closely with the governments from, let's say, the United States, governments in Europe, government Australia, Philippines, you name it. So the international collaboration, which is already quite strong, that's good news. That needs to be further enhanced. Then, of course, you need to work very closely again with the telecommunications sector to help to alert when there is inappropriate contents, that content is taken down as fast as possible. Now, part of that content is often, it's not sitting in Mongolia, it's somewhere else sitting in the world. So that's when you then need to work across the border with other telecommunication companies.
At the same time, Mongolian content could be to other countries,
yes,
which is the case.
Yeah.
And where those who is organizing this kind of content of children abuse, sexual abuse, to be really stopped, punished.
Yeah. So there you need strong.
I'm glad you have addressed these issues. The next one is children with disability. In your statistics says that there are more than 14,000 children with disabilities under the age of 18, but half of them, 7,200 children, are receiving education through formal and non-formal education services. What's happening with the rest?
Well, that is exactly the problem. What is happening? These children have the same rights as any other child. So we need to figure out how can we do a better job in society to support every child with, for example, with their education, with their development, so they can develop optimally. So we need to make that extra push to bring children with disabilities really into the education system.
And it creates a problem also inside of the family. They keep staying, they don't know, they don't send, either have money, or even worse, they don't want other people seeing that they have such a children, and they're sitting in a prison kind of in their own home. I'm glad that you have addressed, at least raised the issue for first time with this level. The last one is about, again, we have a bit talked about that, climate change on children, and your statistics here about Mongolia, in spite of all this steps we made, progressive steps we made, it is this greenhouse gas is at 11.5 tons CO2 a person, which is above a global average 4 and 8 tons per capita. Still, it's a lot.
Yep, it's still too much. It's definitely too much.
And children in particular, when they are small, the lower the emission is more. So what do you suggest? How we can...
Yeah, I think the first thing that we need to realize is, that of course, there is a strong link between climate change and air pollution. Now, if we focus on climate change and the consequences of climate change, what we already see is higher temperatures in Mongolia, less surface water, more land degradation, and more extreme weather events. Massive sandstorms, snowstorms. It's not going to get any better. More extreme floods.
That's we do expect down the road all the way.
Yeah.
Anyway, we cannot
has
avoid
already
it.
started. It will only get worse, and that, of course, undermines the livelihoods of people, and that undermines the health and the well-being of the children. So, and the problem with climate change. There is no medicine, there is no vaccine. We think that the pandemic is difficult. It is very difficult, but the challenge of climate change is going to be even bigger than the pandemic is.
This one also includes, I understand from our previous conversation, that it has to do with a large amount of livestock in Mongolia.
Yep.
How?
Yes, people always get confused about that. The main sources of greenhouse gas emissions in Mongolia, it's a combination of industry, burning of coal for energy, and also livestock. Because livestock, it eats the grass, and then the way it digests, it creates a lot of methane. And methane is a very powerful greenhouse gas. It's
how to get people understanding that this cow in the middle of fields creates methane.
Yes.
That's no good back to you.
Yeah.
I mean, what kind of statistics are existing?
Yeah. Well, I mean, it's kind of a biochemical process that, with the digestion of the grass, it turns it into, of course, nutrients that the animal grows from, and also it turns it into waste products.
So Mongolia has more animals than we can accommodate, or not only as a pasture issue, but also from that perspective.
Yes, both from a climate change perspective and from a land degradation perspective, it is better to focus on quality of livestock and not on big numbers of livestock.
Last question, Alex. How do you see UNICEF Mongolia next 5 years?
I think top priority is going to be to support the children to recover from COVID. And that is in relation to education, child protection, and mental health. And we also need to make a big push on water and sanitation in the schools and the kindergartens. And the other one, we spoke about it earlier, obesity continues to be on the rise as well. And we need to actively work with children and not just talk about it.
And you address these issues in the agreement that you usually sign for every 5 years with the government of Mongolia.
Yes,
Have you done it?
We are in the middle of designing the new UN kind of country framework with all the UN agencies, and then in parallel and in relation also the UNICEF country.
So it is coming inside UNICEF
Yes,
with this.
yes, we are working on it.
Alex, it was a great pleasure as usual. And I'm happy to talk to you because you are addressing really independently or outside third person view on the issues, not to eyes, but not to the eyebrows, but to the eyes. So I'm so happy to have, again, you on the interview, and I wish you all success in your future work.
Thank you so much.
Thank you.
Yes. Okay.
За хүндлэгчтэй өнөөдөр манай дефакто нэвтрүүлгийн зочноор НҮБ-ын Хүүхдийн Сангийн Суурин төлөөлөгч ноён Алекс Хaйкенс оролцлоо. Баярлалаа.